Nice.
About 135 kilometers north of Kampala, 15 kilometers northeast of Nakasongola town, and 3 kilometers from the banks of Lake Kyoga is this Uganda People's Defence Forces manufacturing arm. It is part of Luwero Industries Limited, a subsidiary of National Enterprise Corporation, the manufacturing and engineering arm of Updf. In light of oxygen scarcity in hospitals across the country, coupled with the surge in COVID-19 cases, the Uganda People's Defence Forces manufacturing arm is enhancing the country's capability to access medical oxygen. It was indeed a beehive of activity at the plant. Clad in white overalls, servicemen were seen refilling hundreds of cylinders with life-saving oxygen. These are brought here on appointment from hospitals, both government and private, across the country. Stephen Kavuma, a production assistant at the facility where oxygen is purified before it's being put in cylinders, explains the process.
We supercool the air to very low temperatures at about negative 183 degrees, because that is the temperature at which you can get liquid air. And to do that, we use the heat exchanger and an expander. Once we have the liquid air, we take it to the columns. In the columns, a process called fractional distillation takes place there. And the more dense liquid goes to the bottom and the less dense goes to the top. In this case, oxygen is more dense than nitrogen, so it's collected at the bottom and the nitrogen is at the top. But in the first column, the purity of the oxygen is about 45%, so we send it to a second column for further fractional distillation. In the second column, we are able to get the 99% of oxygen.
We can produce liquid oxygen, which you will see. We can also produce gaseous oxygen, which is more or less like producing liquid oxygen, then you gasify and put in the cylinders.
The plant has capacity to fill between 240 to 275 40-liter gas cylinders per day at a modest fee of 38,000 shillings each.
If you come with your cylinder, we charge you 38,000 shillings. Yes, for a refill. But if you don't have a cylinder, then you'll have to put a deposit of 2 million shillings.
According to Kavuma, they have supplied both government and private.
The first one is Bombo Military Hospital, which have supplied very many cylinders actually. Then Lifelink Hospital is a private hospital, which is in Kampala. Then there's Nigeria Hospital, which have supplied. Then a group from West Nile.
If you have a shortage, most of the hospitals are aware. But all government hospitals, we are intervening through the Ministry of Health, the PS. She calls the Navy Hospital.
Yes.
She called them and directed them to deliver cylinders here. Arua Hospital the same. Morago, it is UPDF which helped.
John Merrick Manyane, the quality control manager, says they have mechanisms to ensure their over 99.9% purified oxygen is not contaminated.
You know, in the marketing there could be also those gimmicks of mixing up products because of killing products people. So we must go and test. If it's our oxygen, we must go back to the analyzer and feed it in and see the percentage. If there is a claim that it is low, see what it is giving. If it's lower than what we produce, we also see was the cylinder tampered with before it came back to us. Because I think that happened with products on the market before you receive it.
The Army's involvement comes at a time when COVID-19 infections continue to ravage the country and the need for life-saving gas during the health crisis.
Mainly it was our Air Force effort, but when the pandemic came up, we saw an opportunity to participate in bridging the gap.
The General Manager of Luwero Industries Limited, Major General Sabiti Mzei, tells us what needs to be done now in service improvement.
The cost of cylinders is high and storage. The cost of production is high because power, even fuel, if you're relying on a generator, The other issue that I think not necessarily related to production is the issue of distribution of these cylinders and management. The logistical aspects of transportation in a time here for filling, then back to where they are needed. So there needs to be some logistical arrangement that helps coordination. General Sabit, however, says despite challenges, there is work in progress even after defeating COVID-19. He says in the long run, Luwero Industries is looking at manufacturing gas cylinders. It will continue to really be relevant, but in any case, with the other interventions, I know that COVID will be brought down and the pressure will reduce, but all these other ailments, I don't think they will go away. So we shall still be able to support that effort. The Army is also manufacturing masks, sanitizers, and liquid soap, part of the arsenals to rid the country of COVID-19 pandemic. Bernard Higa, UBC News, Nakasongola.